All right. So the first question is, once a vaccine is approved, how do you anticipate that distribution will occur on a global scale?
Um, well, there's actually a huge collaborative initiative called Kovacs, which is, a joint effort between Gavi and CEPI and the WHO in order to actually have a coordinated plan for distributing the vaccine globally. And I don't know if you guys have talked about Kovacs in your class, but basically at the start of the pandemic, of course, everybody was like, oh my God, we need a vaccine to end this nightmare. And people immediately said, even if there's a vaccine, the rich countries are going to buy it all up and poor countries will be thrown under the bus as usual. And so there was a pretty rapid response by these big global players to basically try to safeguard in terms of finances and also planning and political buy-in to make sure that the entire world has access to a vaccine. And I know that Kovacs is part of, I'm trying to remember what it's called. It stands for ACT. I think it's Access to COVID-19 Technologies Accelerator. It's like a WHO, I don't know all the details, but WHO basically launched a collaboration platform to get buy-in, not only from different countries, but also from foundations like the Bill and Melinda Gates Foundation, big international NGOs, to provide a platform to create more equity in the face of the pandemic. So not just for vaccines, but also for diagnostic tests and therapeutics, and the goal is to have a situation where all countries and all people in the world can climb out of this pandemic and not just the rich ones. So this was a pretty huge effort, and all the players are kind of like the usual, the A-list of people and organizations that do global health work. So I know that there is, a plan to roll out vaccine access in ways that are equitable and not just determined by ability to pay. But the actual finer details, I'm not really sure. And, and there's many different vaccine candidates. We hear a lot, this week we've heard a lot about the Pfizer and the Moderna ones, which have these especially this Pfizer vaccine has this outrageous cold storage requirement. Mm-hmm. And that would be really challenging in many parts of the world. But there's all these other vaccine candidates that are being funded through this initiative, and hopefully, we'll come up with a better vaccine candidate that might be more appropriate to use in resource-poor settings.
Mm-hmm. Yeah, for sure. Okay, and then the next question is, what factors do you think should be considered in deciding who receives the vaccine first?
There's been a good amount of discussion about this in, public health journals and forums, and I think it's pretty right. I mean, generally, I think everyone agrees that frontline workers need to be vaccinated first. So one of the huge challenges of the pandemic is overtaxing the healthcare system, and so people that are frontline healthcare workers will obviously have to get the vaccine first, not only just to keep the whole healthcare system running, but also because they're already making enormous sacrifices and risking exposure and risking the exposure of their loved ones. And, that sacrifice should really be acknowledged, and, they should have access to this. And it's just really an efficiency argument more than anything, The mild cases of COVID are not the main problem economically or in terms of social disruption. It's the severe cases and the deaths. So the extent to which we can keep those frontline workers, on the front lines and able to do their jobs, then the better off we all are. And arguably, maybe some other frontline workers as well, maybe public school teachers, or people that work at grocery stores, or, there's a lot of different definitions of frontline or essential worker, but at least some of those folks that are at higher risk. And there's pretty broad agreement that people in high risk health groups should get the vaccine first. So people, the elderly, just being elderly is a major risk factor. And there's other medical conditions that predispose people to really bad COVID outcomes. And they should also be made a high priority. So people who are younger, who are not essential workers and who don't have underlying health conditions, they might not be vaccinated for, 6 months, 8 months, a year into the endeavor.
So the next question is, should individuals be able to choose if they receive the vaccine, or should there be a state mandate?
Well,
which I realize these are all pretty big questions.
Yeah, no, they are, but I have some answers. I don't have all the answers, but I have some. In this country, the Supreme Court has ruled a couple of times that it is within the state's power to require vaccination, that is not considered, sort of like a improper amount of power. That, the Constitution protects individual liberties to a certain extent, but when there is a public health emergency, individual liberties legally can be thrown under the bus a little bit. But, so actually, Jacobson versus Massachusetts was like the original case around this. And then it was, there was another one, something versus King, something with a Z, like a German name, like Zucht, I think, versus King, where they reaffirmed that decision. But basically, the state can require vaccination, but not to the extent where like people are forcibly having needles, injected into their arm. Like the state can't go so far as to do an invasive procedure on somebody without their consent. But the state does have the power to levy fines if people are not vaccinated, or to create other incentives for people to get vaccination, or other basically like punishments. So for instance, in Europe, some parts of Europe, measles vaccination is mandatory, but you can't make people vaccinate their kids. But what you can do is say, well, then you can't go to a subsidized childcare. Mm-hmm. If your child's not vaccinated, then no childcare for you, So that way people retain the freedom to make the choice of not being vaccinated, but they have to give up certain privileges, because they would pose then a threat to society. So then the state has the right to say, all right, don't get a vaccine, but here's what you can't do if you're not protected. And I think that this vaccine will be no different from other vaccines. School districts will be allowed to require it. And again, if people don't want to vaccinate their kids, then they can send their kid to private school, or they can homeschool, if they can find a private school where that's not required. So I think it will be similar to other vaccine strategies, where it's mandatory for like public school, but it can only be enforced through incentives or disincentives, mm-hmm. but not like you cannot, you can't stick a needle into a person who has not given consent for that to happen.
Yeah, that makes sense. It's an interesting thing to think about. And then, so the next question is, how long would you expect for the global distribution of a vaccine to take?
It's really hard to say right now because of basically two things. One is that the two vaccines we're hearing the most about do have these cold storage requirements. The Pfizer one is like outrageous, like very few countries could do that. Mm-hmm. The Moderna one is not so crazy. And even like for polio vaccine, that requires a cold chain. And, countries are doing that, like countries that have desert climates, people are trucking vaccine in coolers to very remote places, so it definitely can be done. But another part of the problem is that there's a bunch of other stuff that you have to have in place to actually distribute the vaccine. You know, like you need to have an adequate supply of injectors, you know, for instance. So like we saw with COVID-19 back in the spring, we had the technology to do a laboratory test. Like we had the testing protocols. We didn't have enough nasal swabs. You know, like people couldn't get a test because there was a shortage of nasal swabs. And so just having the vaccine, like doesn't mean that we're ready to go. There's other physical objects, and there's going to have to be a lot of coolers. Like, does the world have enough coolers right now? Probably not. So there's all these other products that you have to manufacture and distribute to facilitate the vaccine distribution. So I would think maybe within 2 years, there would be like a global rollout with the easiest parts of the world to get to, you know, within a year after a vaccine is approved and has been manufactured in quantity. But there's all those other little pieces, you know, and you need trucks that are driving this. You need people driving the trucks. Like there's all these other parts of the process that we often don't think about when we think about a vaccine. You know, if you just sort of follow the chain of like what has to happen and the packaging and everything, it's actually pretty complicated.
Yeah. And so then the next question is, what is the role of the World Health Organization in regulating the vaccine development in various countries?
There is no role whatsoever, actually, because the World Health Organization does not regulate anything. They actually have no real authority. They are a scientific body. They mostly give advice. They do research. They develop technical guidance. They advise countries, but they don't regulate anything, and they have no actual legal authority. And they always have to respect sovereign nations. So, you know, every country, pretty much every country in the world is a member state of the United Nations, and the WHO is part of the United Nations. And the WHO is strictly a technical and scientific authority, not a legal or regulatory authority. And so they won't be regulating anything. There's nothing in their mandate that lets them do that.
So
what they're really good at is trying to be a neutral meeting place where countries can come together and cooperate. But they actually have no authority at all. And even in the case of like a major public health emergency, so like in Wuhan, China, like WHO cannot set foot in China until China invites them in and says, yes, we would like you to do an investigation. They have no authority to intervene at all.
So maybe to follow up on that, is there any like overseeing organization that can kind of regulate the development in different countries, or is it just like every country is sovereign and they can do what they want to develop a vaccine?
Well, every country is sovereign, but this Kovacs initiative and this larger ACT, ACT that I mentioned before, ACT Accelerator, is meant to provide incentives for global cooperation. So every country is free to do what they want, and like the United States is not participating in Kovacs. We do give a lot of money to the WHO and to Gavi and some of the players behind it, but we're not actively participating in Kovacs. And the goal is to create strength through unity and strength through collaboration. So again, it's not regulatory, it has no authority, but it's basically it's like sort of putting everybody in the same lifeboat together and saying that we have to cooperate. So it kind of uses some soft power to get buy-in from countries. And there's sort of like some elaborate schemes about pre-purchasing vaccines and opting in and opting out. But basically there's this commitment that poor countries get vaccine too. Like there's a distribution plan around equity that is like, they put right out there and they're like, do you want to be part of this or not? And part of the selling point is that it helps all of us if everybody in the world is protected. Because diseases, know no borders. And at this point, at this point in human history, like you can get on a plane and be anywhere in the world within hours. So it kind of uses some influence and some soft power and makes arguments about risk to try to get more global collaboration.
Yeah. So my next question actually follows up on that pretty well, because it is globally, what percentage of people will need to receive the vaccine in order to achieve herd immunity?
That is kind of the question of the hour. Nobody really knows that. And it depends on a lot of things. It depends on if people need 2 doses of vaccine, will they be able to get a second dose? Is the vaccine equally effective in everybody? Because it's only been tested on a pretty narrow range of people, the 2 main vaccine candidates. So, it might not be as effective in some people. We might find out that a lot of people are ineligible to receive the vaccine. And we also, even though we're however many months into this we are, 10 months into this pandemic or 11 months into this pandemic, there's still a lot that we actually don't know because of all the asymptomatic transmission. So there's way more people infected than we ever know who are spreading COVID-19 in ways that we still do not even fully understand. So in order to have a good herd immunity estimate, we would need to have a better understanding of disease transmission dynamics than we currently do. And we also need more effectiveness information about these vaccines, across the whole range of humanity, and including, people who are malnourished, chronically malnourished. Would they make an adequate immune response, an adequate antibody response if they're really malnourished? We don't really know those things yet. So that's a really long way of me saying, I don't know.
The next question I have for you is, are we prepared for a mutation of the virus that could make it resistant to a vaccine? Would that mean restarting the entire vaccine discovery process?
Well, a virus, by resistant, you mean would make the vaccine ineffective, right?
Yeah, ineffective.
Because virus, the vaccine wouldn't be a treat. Usually we'd use the word resistant to mean referring to a treatment. So a virus can't be resistant to a vaccine, but there could certainly be a mutation that would make our current vaccine technology ineffective. So we're priming the immune system to make antibodies to something that looks different than what we're actually dealing with a new mutation. That is certainly possible. It would depend on, this is minor, I'm about to go way over my head because I'm not a molecular biologist type of person, not even close. But my understanding is that the best vaccine candidates use mRNA technology to have the body manufacture a protein that is part of the SARS-CoV-2 virus, that little spiky thing, So if a mutation were to change that protein that's in the spike, or somehow fundamentally change that part of the virus, then we could be in trouble with our vaccine. But the mutation could do any number of things. It could change the lipid coating, of the virus. It could change other aspects of the virus. But my understanding is that once we finally seem to have mastered this mRNA thing for the first time ever. And my understanding is that it's actually easier to repurpose mRNA vaccine development than it is other types of vaccine development. So it's a lot of more of it takes place on a computer than in a laboratory to sort of construct get the mRNA to construct this protein. So mutations are always possible. This, the COVID-19 virus does not seem to be mutating at a particularly quick rate, which is good. But I actually, from what I've read about the vaccine development, I'm actually pretty optimistic that even if it mutates, we can then adapt, you know, the mRNA technology. What might suck is that we might have like manufactured like 1.5 billion doses and then, you know, they don't work as well. But I should also add that even if this vaccine can give partial immunity, or even just keep people out of hospitals or keep them from dying, that alone, like we could still potentially use a vaccine even against a mutated form of the virus if it keeps people alive or keeps them out of intensive care. Because that's really the end game with this vaccine. In terms of returning society to something that looks normal, you know, saving the global economy, like minimizing social disruption, it's the mortality and the severe illness that are killing us, you know, literally. So it's also possible that we might get some partial immunity, even from a vaccine that was meant for a pre-mutation virus.
And then, so the next question is, how does the development of a COVID-19 vaccine compare to the development of other vaccines? And we talked about this a little bit, I guess, already with the mRNA comparing to other, but I guess
Yeah.
process.
Yeah, I mean, it's pretty phenomenal. Like people, I think, started working on mRNA vaccine technology, I think in the 90s. And it was always kind of like a hypothetical. And it's actually like almost bigger news than we have a COVID vaccine is we have an mRNA vaccine. Like that's actually major. Like that's the real news story, actually. So this is incredible news. And it does represent a real departure from our usual vaccine technology. Another thing that's great about the mRNA technology is that you don't need to use the virus itself or a part of the virus in order to make the vaccine. And this should help assuage people's fears that they could somehow get the virus from the vaccine. Because people always have that idea, even when it's not possible. But you know, we do have live virus vaccines. You know, like the yellow fever vaccine, that is made with live virus. You know, like it's the real deal in there. Smallpox vaccine has live, it's not smallpox in the smallpox vaccine, but it is live. You know, so that like, in terms of getting people to actually want to take the vaccine, it's really great that we are using this new technology. And my understanding is that the manufacturing is actually simpler than for many other vaccines, where you have to grow the virus, you know, or culture something. Like in the flu virus, we make that in chicken eggs, you know, so then like everyone who's allergic to eggs can't have the vaccine. But like this is more of like a, you know, computer-oriented development and production. So it's really, really good news from a vaccine technology standpoint. And I'm hoping this means we might someday have a vaccine for HIV, which has been like the holy grail of vaccine research. So that would be like mind-blowing if that happened.
How has the COVID-19 pandemic impacted the way that you teach global health courses?
Well, say a couple ways. In terms of content, I've tried to make connections to COVID-19 like in every class that I teach, because an infectious disease pandemic, frankly, is a great lens for looking at global health in general. Like every problem that we have in public health and global health, you can see happening in COVID-19. Like, for example, the fact that people of color are more likely to be infected and more likely to die of COVID-19. That is like classic public health. Like that's true for, you know, health, a lot of health problems in general. So there's a lot of ways we can look at the pandemic and learn lessons that apply to other public health problems. So I've tried to just bring the pandemic into the classroom more without fatiguing people on the pandemic and stuff. Like I've actually really struggled with that. I'm like, to what extent do people want to think about something else besides COVID? And to what extent do they want to really learn more about it? So I've tried to introduce some content without slamming people over the head with it. And then sort of like pedagogically, I was, at the start of the semester, I was like pre-recording every lecture, you know, and like having class time more for discussion. Cause like, I mean, I really figured, I was like pre-recording like weeks in advance, cause I was really like, you know, I'm probably gonna, who knows, like I could be in the hospital, hopefully I won't be dead. Like I just assumed someone else was gonna have to take over my class. Like I was really expecting a lot more local disease transmission than we've had. And maybe that time is coming, but I was like trying to create course materials, put more stuff on Canvas farther in advance so that if somebody had to take over my class, like the students wouldn't be stranded, you know what I mean? So somebody else could just pick up my material. And so I was trying to make it a lot more accessible to other people and planned out much farther in advance, which fortunately I didn't, you know, that didn't come to pass. But aside from that, and aside from the fact everyone's had masks on in the in-person section, you know, which makes it really hard to read the room, you know what I mean? Really hard, because I'm so used to looking at students' expressions. You can see, like, are they confused? Are they bored? Are they curious? Are they excited? You know, it's like, you know, can't really tell what's going on. But aside from that, honestly, partially, I think for my own purposes, like, I just wanted class to feel like a normal class. You know, in a year where everything has sucked and everything has been totally turned upside down, I'm like, let's just have class and learn some global health. It's like kind of what I want to do for myself, you know, as well as what I hope the students want.
Mm-hmm. Yeah. All right. So my final question for you is, how can we better prepare the next generation to be ready for another pandemic?
It's a great question. I think that the number one thing we can do, and this is really a reaction to the current political climate, better educating the next generation about science and about how to identify, how to categorize information that they receive as being valid and substantiated or not. Like I never thought in my lifetime that I would see science so blatantly disregarded up to the highest levels of the federal government. Like I'm flabbergasted that people consider mask wearing a political act and not an evidence-based one. Like I can't get over it. I'm stunned, you know, when so much is at stake, like people's lives are at stake. The lives of their loved ones are at stake. And people cannot process the information that wearing a mask protects other people and you. And, you know, and of course people my age are always like, oh, that darn internet and social media, you know, but like the truth is like there's so much information that people are absorbing and taking at face value, and this information is crap. You know, it's rumor, it's urban legend, it's moral panic, it's all these, it's just not, it's anything but evidence-based. So I think teaching future generations to reclaim the value of science and to demand proof and evidence, you know, and substantiation behind claims will do more, not only for future pandemic preparedness, but for public health in general, you know, for people to understand what is healthy and what is not. So that's one thing, is just, can we please bring science back into the conversation? The second thing is, and I know this, like for years I worked in emergency preparedness and infectious disease emergency preparedness in particular. And when you look at the history of funding and political action around preparedness, it's the way you characterize this history is to say, whenever something horrible happens, all of a sudden there's a lot of money and a lot of political interest in preventing this problem from happening again. And then 2 months later, it's ancient history. You know, the public and the government have very short attention spans. And it becomes difficult to make the argument that we have to invest in preparedness while we all feel really safe and there's nothing going on.
Mhm.
But the truth is, the best time to prepare is when there's not an emergency. That's when you want to actually be doing your preparedness, as opposed to while it's actually unfolding. And we're not particularly good at taking the long view in terms of our national security and our population health. You know, we tend to be very myopic and just focused on short-term gains, but you know, when your house is on fire, that's not when you should be installing smoke detectors, right? You know, like you want to do your preparedness activities when no one is in danger. And but it's really hard because doing population level preparedness requires billions of dollars and huge investments of time and resources. And it's just so hard with shrinking budgets and, you know what I mean, like declining workforce. It's so hard to make the argument convincingly that we need to do preparedness activities now while we're safe and not while we're in an emergency. And I do think that people who are your age and the generation coming up after you have a really good sense of the importance of long-term thinking, because you guys are really motivated by the climate crisis. And you are looking back on, you know, 150 years of industrialization and saying, okay, my generation is now screwed. Thank you, you know, for like only taking a short-term view. So I'm actually optimistic that younger people appreciate the importance of long-term planning, because now we're seeing the negative effects of not doing that, even though we've known about greenhouse gases for, you know, at least 50 years.
So that was the end of my questions, unless you want to add anything else before I stop recording the Zoom meeting.
So I'm going to add anything else. I guess the only thing that I would add, if we can go back to the question about who should get the vaccine first, some of what I've been reading, there's different sides of this argument. Some people have been saying because communities of color have been adversely impacted, like disproportionately impacted by COVID-19, perhaps we should offer the vaccine first to communities of color as a way of kind of making some restitution. And what's interesting is that there's been some research carried out, I think by Julia Wu of the Harvard Chan School, that showed that, I can't remember if it was all minority communities or just the Black community, but in any event, the people who were surveyed actually were better informed about the pandemic than white people were, but more mistrustful of government efforts around vaccine production or, you know, government steps. So this was a well-informed group, but who was not really trusting the government. And there's many reasons, obviously, why communities of color have, you know, don't trust the government. And I've read quite a few articles on this, and, you know, articles where like some Black people were interviewed and they were like, don't experiment on me, you know, like I remember the Tuskegee syphilis experiment, you know, and this sense of like, we're already paying a bigger price during this pandemic, and there's some new vaccine technology, you know, that's not fully studied, and you're not gonna experiment on me, is what some people are saying. So it's just it's an interesting justice question, you know, in terms of vaccine allocation. So there's more uniform agreement among scientists that, you know, healthcare workers and people with underlying conditions need to be prioritized in vaccination. And there's some disagreement about, you know, issues of racial justice around vaccination. So I think that's the only thing I maybe want to add.